Hi everyone. Today we will discuss about BRADAN scale. What is BRADAN scale? What all are the components? How we will measure the BRADAN scale calculation? What is the risk factors? What is moderate risk? All these things. Okay, let us see one by one. Okay, what is BRADAN scale? A simple tool. It is helping for a nurse to assess a patient who is in a risk of developing pressure injury. Pressure injury is also known as pressure ulcer. Why do we need it? This BRADAN scale? Because in the globally or overall 2.5 million patients are affected by the pressure ulcer. The studies are showing this. So we have to reduce the risk of pressure ulcer. And other things are pressure ulcer is causing a significant harm and it's very painful. Expensive treatment, increased length of hospital stay. As long as the pressure ulcer is there and if it is infected and all, patient has to stay the hospital long days than expected. Premature mortality also can happen. And really I wanted to tell you all of you, pressure ulcer is one of the nursing negligency. Where there is a lack of nursing care, patient risk of pressure ulcer is high. So what we have to do? We should improve our skill. We should follow BRADAN scale. Accordingly, we should treat the patient. We should care the patient. What's our goal? To use the BRADAN scale for early assessment and this will allow us to prevent the pressure ulcer and keep the patient safe and comfort. So we will follow the BRADAN scale's components one by one. There are 6 components for the BRADAN scale. What all are those? Sensory perception, moisture, activity, mobility, nutrition, and friction and shear. These are the 6 components of BRADAN scale. Let us see one by one how it is following, how we will be assessed. The first component is sensory perception. This is the ability of the patient meaningfully respond for the pressure related discomfort. We will give score 1 to 4 accordingly. The score 1 is giving for completely limited. Completely limited, that name itself, it is showing patient is not at all able to move the body even for the pain stimuli also. Either patient will be completely unconscious or completely sedated, bedridden patient. Okay. There are very limited ability to feel pain over the most of the body. Very, very limited movement only. Okay. In that case, we will give score 1. Score 2 is very limited. It is responding only to the painful stimuli or has a sensory impairment in more than half of the body. Half body is completely paralyzed. In the half body, there is only painful stimuli. This condition we will give score 2. Score 3, slightly limited. That means responding to the verbal command but cannot always communicate discomfort all the time. Reason is maybe the sensory impairment will be there for 1 or 2 extremities. In this condition, we will give score 3. Score 4, no impairment. Responding to the verbal command and feel no sensory impairment. Patient can respond properly. There is no issues. So that these conditions score will be 4. Next component is moisture. In this, the skin is exposed to the moisture. Excessive moisture can increase the skin erosion. Moisture, how the patient will get moisture in the body? Because of wet, wet surface. Maybe because of IV fluids, maybe because of in case urine are urine passed in the bed. These all things can make and excessive sweating. These all can cause the excessive moisture to the patient. Let us see one by one. These also 1 to 4 score we are giving. In the score 1, constantly moist. Skin is saturated almost all the time due to the heavy sweating because during the fever. If some patients were having continuous fever, heavy sweating will be there. And sometime what I told you, the urine patient passing in the bed only. There is no, if sometime we are putting quantum catheter, if you are not giving attention, there is a chance it will come out. Because it will just be a taping only. The tape will go. So there is a chance patient will be laying on the urine and some other IV fluids like fluids. Okay. These time what will happen? The linen has to be changed sometime every hourly. In these conditions, score number 1 we have to give. Score 2 is very moist. Skin is often but not always moist. Not always, often moist. It's required the linen changes at least once per shift. Score 3, occasionally moist. Skin is occasionally only moist. Required linen changes only once per day. Occasionally means sometime, so one time patient this one fever were happening. It's not a continuous fever and all. So there is a sweating. So it is an occasionally. It is not all the time. Sometime one time patient IV fluid fluid has spilled on the bed. So it is an occasionally and required the changes of the linen in only one time. Once per day. That you see once per day madla we are doing linen changes every day as regular. But extra changes is happening. That is what is once per day I mean. Okay. And in score 2 at least once per shift. So every 8th hourly one time change. Morning usually when what time we are changing the this one bed sheets and all for the patient in the morning time after bath morning time morning shift or night shift they will do it and go. So after that every shift one time if you are changing the because of the moisture if you are changing the bed sheet score has to be given accordingly. Okay, so score 3 is only one time in a day, that means in a day 24 hours one time as usual regular changes is there and other than regular changes one more time we are changing, that time we are giving only score 3. Come to the score 4. Rarely moist. Skin is dry, required linen changes only at the regular intervals. Regular intervals matlab every day in the morning or otherwise sometime. Some patients will tell, no, I'm feeling to change, please come and change. We cannot refuse that. It's a patient comfort. So in that time, we will change. Maybe some other reason. Maybe if a patient was eating food, for example, and some spillage was happened. So they will tell, oh, please change. That we can't consider like a moist. It's become dirty. Okay, so those type of intervals. So regular intervals means it is only score number 4 we have to give. That is moisture. Let's see the another component. The other component is activity. Activity is the patient, how much movement he can do or when he was on bed. Accordingly, we will see the degree of a physical activity the patient is able to do. That is activity. These also score 1 to 4 we are giving. Score number 1 is bed fast, completely confined to the bedridden patient. Score number 1 will give. Score 2 will give for the chair fast, severely limited in ambulation, unable to walk and must be assistant is needed to change bed to chair. In this condition, we will give score 2. Score 3 is walk occasionally. Walks with assistance, spending most of the time in the bed or in a wheelchair. So, this time we will give score 3. Score 4, walks frequently both inside and outside of the room. At least 2 or 3 hours outside patient will walk, or 1-2 hours inside the room patient will walk. In that condition we will give score 4. Next component is mobility. It is an ability of changing and controlling the body position, patient itself. That is calling mobility. Patient can turn this side, left side, right side, but he can able to get up and sit. Those things. That is the mobility. This is also score 1 to 4 we are giving. Score 1 we will give when completely immobilized. Patient cannot move from the position or change any position with himself. He need for changing any position, he need any assistance. This condition we will give score number 1. Reason will be maybe patient is unconscious, maybe patient is completely bedridden, or advice of bed rest, completely no movement at all. Maybe some due to some surgery or some other disease conditions. Okay. The score 2, very limited. Patient makes occasionally slight position changes but need assistance to change their entire position. A slight movement he can do, but changing other complete positioning means he needs some assistance. That in that situation we will give score 2. Score 3, slightly limited. Patient makes frequent changes of the body position and small position changes on their own, but still they need assistance to change the position in the bed. This condition we will give score 3. Score 4, no limitation. Patient can frequently change their movements. Major position changes, patient can do it without any assistance. In this condition we will give score 4. This component is nutrition. It is the food intake pattern of the patient. In this also score we are giving 1 to 4. Score 1 will give for the poor, very poor intake. Okay. Patient is maybe on NPO, nothing by mouth. That is the form of NPO. And on clear liquids, occasionally patient is taking only clear liquids, nothing else. Or receiving inadequate fluid intake more than 5 days. In these conditions, we will give score 1. Score 2 is probably inadequate. Patient is receiving a clear liquid diet or 2 feeding that does not meet the nutritional requirement of the patient. In this condition, we will give score 2. Score 3, adequate. Patient is receiving 2 feeding or TPN, total parenteral nutrition, that likely meeting their nutritional needs. In this condition, we will give score 3. Score 4 is excellent. Patient is eating full meals without need of any nutrition supplement. Himself, he can eat food, enough food. He is taking orally and intake output is adequate. In this situation, we will give score 4. Next is friction and shear. Friction and shear, the force between the skin and other surface like mattress, chair, this is only categorized 1 to 3 scoring only. Okay. All other component there was 1 to 4 scoring. In this one only 1 to 3. There is a friction. Friction means it is frictioning when to surface. Skin with the mattress or with the chair. So these frictions are happening also. There is a chance of getting, patient will get the chance to get a bed sore. So score 1, there is a problem. Patient is required moderate to maximum assistance to move. Otherwise, there is a chance patient may get friction in between. In this condition, we will give score 1. Score 2 is a potential problem. Patient can move feebly but requires minimum assistance. Okay. In this condition, we will give score 2. Score 3, no apparent problems. Patient move independently in bed and in a chair. This kind we will give score 3. Now let us see the risk level. How we will see the risk level? Risk level we are seeing after giving each score, we will calculate the total score. According to the total score, we will tell the risk level. The scoring pattern is the higher the score, if the higher the total score, the lower the risk of the pressure injury. Okay, if total score is high, the pressure injury is having, there is a very less chance for getting a pressure injury. The score, how much the score is high. If the score is coming down lower, the risk is increasing. Okay. The total scoring, we are giving score number 1, 2, 3, 4 for all the components. No? Accordingly, after we are calculating and seeing if this we are getting a score 90 to 23, patient is not at risk. If 15 to 18, patient is at risk. 13 to 14, moderate risk. 10 to 12, high risk. 6 to 9, very high risk. I told you already, if the score is coming down, the risk level is coming high. If the score is coming up, the risk level is very low. Maximum score is 23, the minimum score is 6. When we should perform a BRADAN scale for a patient? Patient's own admission. Within 8 hours of the admission, we should perform. And the reassessment has to be happen frequently based on the patient condition. On admission, what was the condition we got? Accordingly, we have to do the reassessment. Or sometime after admission also, patient's condition may be gone down. It may be worsened. Okay. So, in that accordingly, the condition, we have to do the reassessment frequently. And significant changes. That is what nothing but I told patient conditions may be changed. Suddenly after while receiving patient was completely okay and only the vitals was having any issues. But suddenly patient become unconscious. There will be patient this diagnosis we are doing only we don't know. So in these conditions and all, it has to be significant changes will happen. So reassessment whenever a significant changes in the patient condition occurs, we have to do the reassessment. Okay, this is the timing of the performance of the BRADAN scale. Being a nurse, you have done the performance of BRADAN scale assessment and you calculated the scoring also. You understood your patient scoring. So if you are getting a patient score, accordingly you should plan your care plan. How you will give the care for the patient to not to get a further damage of the skin, not to get the not make the patient to be out of the risk level. Okay. So if the patient is getting the BRADAN score 15 to 18, patient is at a risk level, we know. So what we have to do? We should initiate a regular turning schedule and enable to be much activity as possible as per the patient disease condition. Some patient disease condition, we are not able to move patient and we cannot make the patient to be do any active passive exercises and all. So according to patient disease condition, we should activate the activity for the patient. Protect the heels. We should support the heels and all. We should know first of all what all are the pressure sore areas that we will learn in the pressure sore scale. Okay, next class. Protection to the heels. Use a pressure redistributing surface. Redistributing surface, something like nothing like that. We have to put the air mattress, all those things. Okay, manage moisture, friction, and shear. We have learned already what is going to be happen with the moisture and what is friction and shear and all. Okay, if BRADAN scale is 13 to 14, moderate risk is there. So in this moderate risk, all the risk factors, what all are the care plan we have to follow other than in additional. Position the patient at 30-degree lateral for using with the firm wedged pillows. Okay. If the patient is getting 10 to 12 scoring means patient is having high risk. Follow all the intervention with the moderate risk. And in addition, implement a regular turning schedule every 2 hourly and encourage small positioning shift frequently. BRADAN scale is 9 or less. It is a very high risk. As I have already told you, the level of the score is coming down. The risk of level is becoming very high. Okay, follow all the intervention of the high risk. And in addition, use an advanced pressure distribution surfaces, redistribution surfaces for the patient with the severe pain and multiple risk factors. So this is about BRADAN scale. I hope you all understood what is BRADAN scale, how to do the assessment, what is scoring, how we will calculate the score, and what all are the nursing care plan we have to plan according to the score. Okay. Thank you. Thank you very much.